Lesson 28: Gender and Other Cross-Cutting Issues, Education, General Health, and Mental Health. Lesson Objectives. This module discusses the intersectionality between gender and other cross-cutting concerns, such as access to education and health services. At the end of this lesson, you should be able to discuss how and why gender lens is necessary in understanding other social issues and show appreciation of the intersectionality between gender, education, and health, especially mental health. Definition of terms. Social services. Services that are necessary for individuals and families to maintain social functioning and achieve their utmost potentials. Education. Process of teaching and learning and related activities geared towards making this process organized, effective, and response to people's need. Health. Sense of well-being, absence of disease. Mental health. Sense of mental well-being which allows achievement of human potentials through positive coping. Introduction. In earlier discussions, it has been noted that laws provide for equity among people of all genders. In principle, humans regardless of genders have basic human rights emerging from their intrinsic human dignity. Practically, these rights are translated into programs, projects, and services that are made accessible to us for the purpose of satisfying our basic needs and for achieving our highest potentials. Regardless of gender, we have seen that people are capable of making something, of creating, of making responsible choices, of developing. This capability is promoted by resources we have to access to. The state has a role in making sure that we people receive the services we need and deserve. Two primary needs of individuals are access to education and access to health services. Gender and education. The UNICEF 2011 report on adolescents show that while there is already an increase in access to education for all genders, there remains to be many girls and women who are unable to go to school. However, interesting trends can be observed from the 2013 Functionally Literacy, Education and Mass Media Survey, or FLIMS. This study showed that there are more males, 4.6 in a 1,000, children aged 6 to 14 who are able to attend school compared to females, 2.4 in a 1,000. However, for people aged 15 to 24, there are actually more females, 2.4 in a 1,000, who are able to go to school compared to males, 11.2 in a 1,000. Philippine Statistics Authority 2015. This may mean that while there are more males who are able to receive basic education, there are more females who are able to proceed to higher education. Practically, this only shows that interventions towards making education accessible to women and men may also differ, encouraging younger girls to go to basic education and providing opportunities for men to earn a college degree.
Gender and health. Another basic social services we all need is health service. Health, according to World Health Organizations, does not only mean absence of diseases but a state of well-being. The Department of Health of the Philippines follows a cluster approach in health wherein there are more primary clusters: public health, water sanitation and hygiene, nutrition, and mental health and psychosocial support. In earlier lessons, we discussed that males and females have unique reproductive health needs. This also means that in terms of health services, all genders should be able to access services. In turn, health services should also be gender responsive. Gender and mental health. One of the most prevalent issues facing adolescents nowadays in mental health, the changing environment also brings forth stressors that are not existing before. People are challenged to pay attention not only to their physical health but also to their psychological wellness. In the context of gender and sexuality, some issue faced by humans related to their sexuality and to the roles they assume in the society and are mental or psychological in nature. Some of these issues are as follow. Coping with sexual and reproductive health issues, teen pregnancy, STD or HIV, confusion and doubt. Psychological impact of SOGI, related concerns and gender roles and expectations. Psychological concern emerging from intimate or romantic relationships and psychological trauma from GBV. Hence, there is also need to establish systems so people would have access to service that address these issues. In schools, for instance, there are counselors, trained professionals who has a master's degree in counseling and have seated and passed a license in counseling, who deal with students' mental health concerns in some other schools and workplace. There are also psychologists, trained professional who have a master's degree in psychology and have seated and passed a licensure in psychology. Social workers, trained professionals with license in social work, and psychiatrists, a medical doctor with specialization in psychiatry, who are able to provide additional and more specialized help. This is the summary of our report. As our course culminates, this lesson only underscores that gender and sexuality principles are not only exclusive to those people who are specializing in these topics. In fact, having a clear and solid gender lens will help us perform our task better in whatever field of expertise we are in. These lessons emphasize that in various spheres, making sure that unique issues, concerns, and needs of women and men and the LGBTQ+ shall bring us closer to our desire to promote human rights and uphold human dignity.